Hi everyone, my name is
Hi.
Nathan. I'm from the European Pain Federation, and today I'm joined by Professor Winfried Meißner, and they're going to give us some more information about their session at this year's EFIC 2023 in September, held in beautiful Budapest. How are you doing this morning? Welcome.
Hello.
Hi.
Welcome. Mhm.
So thanks so much for taking time to speak to us today. We really, really appreciate it. If you just want to start us off, would you be able to tell us a little bit more about who you are and what your background is?
Yeah, my name is Winfried Meißner. I'm working in Jena. Jena is a small university town, more or less in the middle of Germany. My training is anesthesiology, and I'm specialized in pain management and specifically in post-operative pain management for many, many years now.
Many years. Great stuff. Great stuff. Well, we're really looking forward to seeing you at EFIC this year. Could you give us a little bit more of a background to the focus of your session that you're going to be delivering?
Yeah, I will focus on post-operative pain, and I will focus specifically on clinical issues. So I hope that I will provide you with some new information about how to treat patients, specifically how to meet the individual needs of patients. So the idea is, what can we learn from specifically from registries, from large data collections we have run in the past, and also other groups, and how can we improve our pain management after different types of surgeries? Not only immediately after surgery, but also how can we prevent or at least reduce chronic post-surgical pain. This will be another topic of my talk.
Fantastic. So a good breadth of what you're talking about there. That's really good. So we know that you have a strong interest in patient-reported outcome measures. Can you tell us a little bit more about sort of what they are and how good scientists are at using them in pain trials?
Yes, certainly. So patient-reported outcomes, I mean, everybody knows the NIS scales and similar scales are used for many, many years. And they, on one side, have a lot of advantages. They represent patients' experience with pain. And this is very important because pain is still not objectively to measure, at least only parts of the pain experience. So we still rely on patient-reported outcomes, and this is a good message. However, there are some issues. For example, what we know is there are differences between cultures when answering certain questions. There are also differences between patients with and without experience of pain. And so we have learned in the last years quite a lot on how to use patient-reported outcomes better than in the past. And I will present some ideas. What is an, let's say, up-to-date or state-of-the-art use of patient-reported outcomes? What are their advantages, but also what are their limitations?
Brilliant. So those are tips and those are things that people could take straight away from the
Yeah.
session. You know, we use patient-reported outcome measures quite often, but perhaps the information that you'll give will really contribute to being really confident and taking the information from that and using it in an effective way.
Exactly. Yeah.
Fantastic. So just brilliant. That's a great little insight. So just finally, why in general, why should people attend your plenary session at the conference this year?
I think it's hopefully worth to join my session for two reasons. On one side, for clinicians, for people, doctors, nurses working in clinical routine. I will give you some information how to use patient-reported outcomes, what we can learn from them when specific patients need specific types of pain assessment. I will also present some preliminary findings on measurement of physical activity after surgery, which might be a good addition to obtaining patient-reported outcomes. And I also will show you some ideas when you do research. What can we do with patient-reported outcomes in research? What are the, again, the advantages? Where are limitations of future developments? So these will be both these topics I will address in my talk.
Fantastic. And again, it sounds like it's loads of practical stuff that people can take away. And it sounds really exciting, really good. So yeah, again, thank you so much for taking time today to speak to us. There's some really, really interesting things, and we're looking forward to seeing you at the Congress this year and obviously hearing more about your thoughts.
Yeah, thank you. Thank you very much.
We'll see you there.